So the first talk was on allogeneic stem cells, or I should say allogeneic cell therapy, pros and cons. That was the name of the talk. And that gave me an opportunity to really bring forth, what the future of regenerative medicine will look like. Where I talked about all different types of bioengineering research that's going on, what we are going to see as future in terms of the therapies we may be able to bring to our patients. I talked about genetically engineered cells, tissue engineering, all the research that's going on, as well as what it would look like, and in future, of course. And then I gave my last slide was about the scenario where you could think about a genetically engineered cell programmed exactly the way you want it to be, implanted in a host or a patient with a perfect microenvironment that we can control now. And here is the key to unlock the shackles of these chronic disabling pain conditions that we have had for years that we have had no solutions for. So this is what the lens of future looks like. And of course, we are really miles away from that, but it's really important for us to at least know what's coming our way. And my sincere hope is that the clinical science, clinical applications someday catch up to what the advances in basic science have been. But this is how it starts. It starts with thinking out big, being a part of the research process, being a part of staying engaged, sharing information, and getting the science out and moving the whole field forward.